Today we're coming live to you from Wound Care Today in Milton Keynes. I'm with Rachael Southam. Hello Rachael, who's going to tell us a little bit about Zetuvit plus silicone border. Over to you, Rachael.
Thank you, Kirsty. So, as Kirsty mentioned, I'm going to talk about Zetuvit plus silicone border, but I don't really want to start talking initially about the product. I really want to take us on a bit of a journey rather than just product focused. So I want to take us back to 2018 by a study by Jackie Stephen Haynes, where we looked at kind of nearly 2 out of 3 patients with moderate to severe exudate were treated with wound dressings that had insufficient absorption capacity. If we move forward to 2019, we can see that then there was a new wound exudate document actually published, and that was on the effective assessment and management of wound exudate. And as part of this, there was an addition of superabsorbent polymers for managing moderate to highly exudate levels, and also the prevention of peri-wound skin complication and helping to improve patients' quality of life. One of the other things which we've actually carried out is a survey on 250 clinicians, and they were actually asked if there was one improvement they could do for silicone foam dressings, what would this be? And actually that would be better performance in both the absorption and retention capacities of those dressings. So going towards the product now and touching on Zetuvit plus silicone border, this is the new silicone super absorbent dressing with border for optimal moisture management from Hartmann. And there's 2 key areas that I really want to discuss here. The first one is the absorbent core. The absorbent core is unique. It's super absorbent polymers and cellulose. And that unique combination really makes a conformable and comfortable combination. And I don't know if many people out there know about super absorbent polymers, but I want to touch on kind of what those do. And actually they sequester bacteria, exudate and odour into the dressing, locking it away so that it can't be released back into the wound. So they're really key in managing that exudate. The second thing I really want to talk about here is the silicone contact layer that's across the whole wound surface. And that's not just on the actual interface of the dressing, but there's also a silicone border. And that's really there for kind of intuitive application and to help it adhere to the wound bed. So there are some key product benefits for this product as well. And rather than just touching on that for the clinician itself, we also believe there are some key benefits for the patients too. This is really helping them who are socially isolated, helping them to regain their confidence. And actually there are some benefits for the clinician as well, so how they can prevent exudated related complications by using this dressing itself. So if we look at 3 of the key benefits here, we can really break these down to the effectiveness of the dressing, so actually the really good absorption and retention capacity of the super absorbent polymers, and whilst it's absorbing the exudate, also maintaining that microclimate that's required for wound healing. Also, the dressing itself helps to avoid leakage and prevents peri-wound skin damage by retaining that exudate within the dressing. The second area and benefit of the product really is its versatility. So it's really simple and intuitive to use and apply. It's suitable for all chronic and acute wounds, and it's also suitable for moderate to highly exuding wounds as well. So it's simple to choose and it's simple to use. And the third thing really is that it's patient friendly. So it's not just that it obviously helps the patients regain their confidence, but it does this through alleviating concerns of odour and leakage. And also the silicone contact layer actually can be atraumatic for when the dressing is due to change. It can actually reduce pain when the dressing is being changed. And that combination of both the cellulose and the SAP means that it is really comfortable to wear, and it pads that wound and provides some cushioning also. So I'm going to touch on some of the absorption retention here, but I'm not going to go into great detail on the graph. The graph is just there for you to kind of look at yourselves. But really what we're proving here from the evidence that we've actually pulled together ourselves is that Zetuvit plus silicone border provides better absorption and retention than other silicone foam dressings on the market. And here, one of the things I really want us to focus on is that study that we actually talked about at the beginning of the 250 clinicians. And really here, their main improvement was that they wanted to actually improve the retention and the absorption capacity. And we believe that from the evidence that we've gathered, we are doing this with Zetuvit plus silicone border itself.
Thanks, Rachael. That's really informative, and I think it's given us a good idea about the benefits of Zetuvit plus silicone border. Now, if you don't mind, I've got a few more questions I'd like to ask you. So the first one is, where do you see the role of this product in clinical practice?
So we appreciate that all wounds are different, and all exudate levels are different as well, and each wound is different for each clinician.
Absolutely.
So where this dressing fits in with their current protocol is really to give them that confidence. We are positioning it within the moderate to highly exuding wounds. However, we really want to give the clinicians the confidence that if they're not there and the exudate level changes at all, they can really ensure that that dressing can cope with the exudate levels that are there and give them that confidence that they can rely on the dressing itself.
Yeah, and I think that's really important. So is the dressing easy to apply, and how do you apply it?
So the dressing's really easy to apply. So the silicone contact layer across the whole of the wound interface makes it really easy, and the border is obviously adhesive also. From our current evaluations, we've had some really good feedback on those, but one of the main things is that when people are applying the dressing, to actually apply pressure across the whole of the dressing, the back of the dressing, so that it secures tightly across the whole of the wound bed, and then secure around the actual edge of the dressing to ensure that the border is fully actually adhered to the skin to avoid any rucking or moving when it's being worn.
Okay, that really gives us a good idea of how to apply it. So in our clinical practice, a lot of our practice is looking after leaky legs. So can the product be applied under compression?
Yeah, so this is one good thing about the dressing.
Yeah.
It can be applied under compression.
Oh, excellent.
And one of the other things that we touched on before is that actually the combination of both the cellulose and the superabsorbent polymers means it's not only going to manage the exudate that's there, but it's also going to be very conformable, so the dressing itself can be moulded around the leg, and it's also going to be very comfortable. So it provides that padding, but it also remains kind of the same depth and underneath the compression of the whole time too.
Fabulous, thank you. And when and where is the product going to be available?
So the product's available today. It's available both on drug tariff and NHS supply chain, and should be available across all total purchasing systems as well. So we're launching it all to you here at Wound Care today. So yeah, please go and have a look at it.
That's really great. So lastly, Rachel, how can people find more about the product?
So there are two ways. So what we'll encourage is that if you do have a Hartmann representative, please reach out to them, and then we can then obviously start discussions around evaluations. If you don't know who your Hartmann representative is within your current local area, please reach out to us, and we can then get in contact with you and start some discussions whether you'd like to evaluate the product. And also one of the things I'd like to touch on here as well actually is the partnership that we have with the Journal of General Practice Nursing, and that's we actually have a GPN Academy. So you can use the link on the slides and go online, and you can actually have some education and learn more about kind of key areas within wound care.
That's lovely. Thank you so much, Rachel, for increasing our knowledge on this new product, your Zetuvit Plus Silicone Border. Thank you very much for watching. We hope you found this session useful, and we hope that you will join us again live later on for more Facebook Live sessions.